So I joined DAMS only during the starting of my internship. That was in this year, early February, I think. Before that, I was running behind sources. I used to have lots of guidebooks. Every subject I used to have guidebooks. So my first advice is don't run behind multiple sources. Single source, multiple exposure. जो CFM में पढ़ता है ना, single source, multiple exposure. जो academics होता है ना, तो your strategy should be single source, multiple exposure. You should have a single source and you should revise it multiple times. Okay, this is my first thing to tell to you. Another is RRR. Revise, revise, and revise. There is nothing better than revision. I think I have completed nearly 7 times revision in my internship. So you have to revise, revise, and revise. Another thing, you start giving grand tests. Start with 1 GT per month. I started giving DAMS grand test in the month of February. I started with 1 per month. Increases to twice per month. And at the end, you should be doing 1 GT per week. Okay. Doing GT is not like you do a GT. Sometimes खराब रंग आएंगे, अच्छा रंग आएंगे, अच्छा रंग आए तो अच्छे चिल मारेंगे और खराब आ गए तो डिप्रेशन में चला जाता है. ठीक है, don't feel depressed after GT. It is only a number. The rank is only just a number. It is an opportunity for you to revise and modify your strategy. Okay. What I used to do is, after the GTs, I used to take the worst subject of the GT. It will be usually 3 subjects will be in the top worst performance. And I used to revise that subject and I make sure that these 3 subjects will not be there in my worst list in the next GT. Okay. So, and whatever mistakes you make in GT, make sure that you won't do it in the next GT. Okay. Okay. Another thing regarding INSET exams are concerned, nowadays questions are getting more clubbed with different subjects. Like it will be like a medicine question wrapped with a microbiology or pharmacology or maybe even physiology. So you should know how to read a question, how to approach a question, what to read, what not to read, how to read an option, how to roll out the options. In this INSET also, there were many questions which you can do if you know how to roll out the option. So very important thing is how to read the question, which part you have to focus. There are some keywords in the questions. By the end of like when you are doing GT and listening to the video, you have to listen to the video solutions of the GTs. Okay, then you will understand how to read a question, how to roll out the options, and how to make a guesswork. Okay. As far as the INSET exams are concerned, you have to be very aggressive. If the exams are in the average side, you have to be very aggressive. You have to mark 190 plus to win top ranks. So okay. So if you want to be aggressive, you should know how to roll out the option, how to guess correctly. Okay. So that's a very important thing as far as INSET exams are concerned. As far as this November session was concerned, there were many one-liner type of questions. We used to think there would be more clinically oriented, very, very big paragraph questions. Of course, there were lengthy questions, but more than that, there were clinical one-liners, not that factual one-liners, clinical one-liners. So whenever you are reading the notes, you should focus on that. Okay. These questions are like a piece of cake, and you should not make these mistakes in these simple questions. When you are making mistakes in simple questions, rank will drop. Okay, so simple questions never get it karna hai. Okay, then so GT is the main part of my preparation. I did GT right from February, and what rank I got, this was similar rank I used to get in GTs also. So DAMS GT is like a exact replica of the real exam. Okay. So start giving GTs. My sincere advice, start giving GTs. Don't wait till the 100% completion of your course. Okay. Never wait. If you are waiting for the completion of the course, it will not happen. The subject is very fast. Okay. So start giving GTs. Start with 1 per month. Increase the frequency. At the end, you will be doing 1 GT per week, and you will be doing the analysis video also. Okay. I think that DAMS is the only platform where you will get video solution for the grand test. Okay. So make advantage of this grand test. Another very important and scoring session is image-based questions in INA exams. DAMS is having a module called DAMS Visual Treat, no? DVT. Many questions were there from DVT. It is having a very good strike rate. So please go through DVT session. And another one is AIMS capsule. AIMS capsule is having all the repeated topics of the AIMS. Okay. And AIMS capsule and DVT. There will be direct questions from these modules. Okay. And there is previous year topics. I won't say previous year questions. I will be saying previous year topics. Previous year questions repeat करता है, उससे ज़्यादा previous year topics repeat करता है. Okay. So whenever you are doing previous year questions, go through that particular topic also. It will repeat. Definitely it will repeat because INICET is an exam where topics are repeated. If you are following the trend, you will understand. Okay. And this time they did it in 2 sessions, 2 slots, morning and evening. And what we came to know is that it was a kind of balancing paper. So whatever they asked in the morning, ulta puchu evening mein. Same topic, different mode of asking. Okay. So again, the topics are getting repeated. And I think 2 questions are same question repeated in the evening session. Okay. So start doing GTs. DVT is a very good module. AIMS capsule. Okay. And please don't run behind multiple sources. Stick to one source, single exposure, multiple exposure, single source. Okay. And this is only what I have to say. I want to tell you. If you want to ask, you can ask.